Now, the excretory system, the kidneys and the ureter, it goes into the urinary bladder and then through the urethra and passes the urine. Now, you have to know the mechanism that how does it come. If it is because the urethra has a sphincter and in the male there's in between there is a prostate gland. Now, the urine has to pass from the kidney, it has to pass down. So, ureter is a mucomuscular tube that carries urine from the renal pelvis of the urinary bladder. This is the pelvis of the. Now, length 25 to 35 centimeters, lumen star shaped. You will see in the histology slide, it is star shaped. Now, the wall of the ureter has the following layers: inner smooth mucous membrane layer, middle smooth muscle layer, outer adventitial or fibrous coat layer. This is simple, it's a tube. Now, inside it is lined by the smooth is a mucous membrane layer and middle smooth muscle layer. The muscle will contract and then it conveys the urine. And especially in renal colic, if there is a small stone even, then there is severe pain. And the body system tries to expel that small stone through the ureter. Even now stones of this size, 1 centimeter or less, it will go and come through and it will come like this. And then it might be in the uretrovesicle, where the ureter is entering the bladder, it stays there, lodges there, and it expels. So, you have to, now I'm just going, the discussion is little, I'm not very much focused, but I am focused. But I want to say how the ureter propels and tries the body system, the nature's way of behavior, that it tries to expel that with the muscular action, and there is severe colic pain, and it might not be stuck, but it is quite big size. So, it's lodged here, but it can be with no hydronephrotic changes, with no hydronephrotic changes. How will you know that? Through ultrasound, if it's a hydronephrotic kidney or not. Okay. And it might be the ureter also swells up. Swells up means not due to this thing, diameter increases because it is like you see these balloon, that lamba balloon, that long balloon. If you try to squeeze, it will blow up like this. So, it is like that if there is any urinary excretion or the hydronephrotic changes, then you go for or there might be, you say no, I am saying hydronephrotic or no hydronephrotic. Now, hydronephrotic changes is there without any obstructive features. There is no obstruction, so the urine is passing, but there is some stasis, and also that can be completely blocked by a large stone, okay, and that you go for operation. Now, there's beautiful cystoscopes are there, and when you go for surgery, there's a small basket like a Dromia's basket that takes down the stone. And now, and the USG you do, and also IVU, intravenous urography. You give an injection, and first you take the, you have to do the bowel preparation and the thing for 5 days, and some enzymes or digestive enzymes and some PPI and bowel, some laxatives. So that you go for a IVU, a straight X-ray will be taken as a control. And then the injection will be given, then there will be a series of radiographs, that is 5 minutes, 10 minutes, 15 minutes. As the drug goes and it gets secreted and it goes down from the kidney to the ureter, and if there is any blockage, then that doesn't pass up to the thing. But the other side is functioning, it goes to the bladder. Now, similarly, now your USG will give you many information. IVU will give you, when you see the radiological plates we have, and we will be given you in exams, the IVU series, intravenous urography series, nothing to panic about. It's all normal plates are there. And if you need not panic, because if it is a blockage, you see, if the arrow the examiner puts in, or will put in the, what is this portion, the ureteral vesicle, over here it gets lodged. And if you just tell the patient on the first day and give a 10 days treatment of alkali and this, there are some agents, modern medicine, even Ayurveda medicine, that tries to dissolve the stone, but that can be small stones. But you don't be in a surgery, go for a surgery, immediate surgery. No, at operation korte hobe. Because many ways of this thing, handling this. Okay, now we'll go and see. Now, the mucous membrane consists of the following layers: lining epithelium, transitional epithelium, 4 to 5 cell thick, lamina propria, connective tissue. Mucosa shows numerous longitudinal folds, hence the lumen has star-shaped appearance. Smooth muscle coat, smooth muscles arranged in 3 layers: inner longitudinal, middle circular, and outer longitudinal. The layers are not distinctly marked from each other. The outer longitudinal muscle layer is present only in lower 2/3 of the ureter, and that can be a MCQ question. Now, if you take it as this is 1/3, this is 1/3, and this is 1/3, then this is the the 3 layers. Smooth muscles are in 3 layers: inner longitudinal, middle circular, and outer longitudinal. These layers are distinctly marked from the outer longitudinal layer is present only in the lower 2/3 of the ureter. Now, adventitial ureter is embedded in the retroperitoneal connective tissue that forms the layer of ureter called adventitial. Adventitial contains adipose tissue, blood vessels, nerves, and lymphatics. You just think that all these organs are extraperitoneal. তুমি হাতটা আছে বালিশের ওয়ার্ডে ঢুকিয়ে দেবে, তারপরে তোমার এটা কভার হয়ে গেল, কিন্তু তোমার প্র্যাকটিক্যালি বাইরে থাকছে, ইটস extraperitoneal. This is when you are studying peritoneum and the viscera's covering thing, you take a pillowcase and see it's double layered. So you think that is in the abdominal cavity. So you put in your hand, this can be acting as an uterus, the upper folds goes into the bladder, posteriorly rectouterine pouch. So this is extraperitoneal and the tissue. Now when you open the abdomen to see the kidney, you can see the, when you go to the posterior wall, this packing material, your parcel for Holi is sending your friend is sending a parcel in Amazon. So the parcel is so much, a small gift, but that's covered with all that plastic bubbles and all this. So the connective tissue and the things are, the adventitia contains adipose tissue, blood vessels, and nerves and lymphatics. বুঝে গেল? So now again this is a repetition. Now this is in red. This is in red. Mucosa, transitional epithelium, lamina propria. Smooth muscle coat, longer, inner longitudinal, middle circular, outer longitudinal, only in lower 2/3. Adventitia consists of retroperitoneal connective tissue. Yeah. Histology of the transverse section of the ureter. This is the transitional epithelium. This is the lamina propria. This is the smooth muscle layer. This is the adventitia. This is adventitia. The mucosal folds. See, now if you see the thing now, if you open that, when you think a stone lodged, the star shape gets that's distorted. Distorted. So see, when you see in the histology section, you will see this. Now you can see the histology of transverse section or lower part of the ureter, H&E stain, the transitional epithelium, the smooth muscle layer, adventitia, and inner longitudinal layer, outer longitudinal layer, middle oblique. Now, I told you, whenever you view a slide in practice, not in the examination, you don't alter anything, only you focus, you according to your, if anyone is wearing specs, then you accordingly, you adjust the focus and see. But when you are learning in the histology lab, I have been stressing, see it in 10x first and see the whole slide, the section. Then you see in 40x and see it will be enlarged. It is like taking a picture by drone. If this gentleman takes a photograph with the still camera or your video, but only he has to get one small span. But when you take it in drone, you can get a big volume. You think that when you are in 10x, you can see the total descriptive part of the tissue concerned, and then you go to 40x. If you want to see in larger magnification, you can do, but 100x or more, or oil emulsion, you have to put oil emulsion, you have to put a drop of cedarwood oil, you have to take it from the technician and put it.